It's Thursday, December 11th, 2025. Welcome to Make It Make Sense. I'm Grant Herms. Today on the show, after promising a vote on healthcare by the second week of December, this week, we're getting two votes that are going to go exactly nowhere in the Senate as Republicans argue over a few plans to get rid of Obamacare again. That is happening while some Republicans have gone around the Speaker of the House for the second time in a month to try and force a vote to extend Affordable Care Act help for millions of Americans and to stop prices from skyrocketing. But in the meantime, your health insurance, no matter who you are, is going to get more expensive. I'll explain why. But before we get to that, make sure you're subscribed to the show wherever you get your podcasts and on YouTube if you're a watcher there. Sign up for the Make It Make Sense Substack, where it just dropped a brand new piece of original reporting about how people working to prevent child abuse are saying the Department of Education is putting kids in harm's way after it targeted degrees for people who are required to look for signs of abuse by law. And we don't know why the department is doing it. But that story is only for paid subscribers. If you're not one, you're in luck, because right now, Make It Make Sense is holding an end-of-the-year subscription drive. Paid subscribers get access to weekly original reporting, the brand new newsletter, Things You Forgot from Civics class, which is a quick hit of the stuff we should have learned or are too embarrassed to say that we can't remember from our days in social studies or civics class. This week's newsletter, all about who calls the shots when it comes to going to war. You also get access to the subscriber chat and the full archive of Make It Make Sense. Monthly paid subscriptions start at just $5 a month. Annual subscriptions are 20% off that price. That's $50 a year. So let's be honest, that's less than you're going to spend on your next DoorDash order. And I promise nothing you get from here will ever show up cold or soggy. And our Making the Most Sense founding subscribers, you get all of that stuff plus a locked-in price for life no matter how much subscriptions go up in the future. You can subscribe today at the links in the show notes or go to mimsnewspod.substack.com. All right. Let's get on with the show. Give the gift of luxury this holiday season with Cozy Earth. Picture it. A quiet holiday morning, everyone together wrapped in warmth, laughter, and that perfect kind of cozy that you just wish you could bottle all the time. Well, a silent night starts with the right sheets. And Cozy Earth's bamboo sheets are the ultimate gift. It's everyday luxury elevated. The kind of comfort that turns every night into a serene escape no matter how much clatter arises. Plus, every sheet has a 100-day sleep trial and a 10-year warranty. You really cannot go wrong. And don't forget about the pajamas for those holiday mornings. The women's stretch knit and the men's bamboo sets are made for those slow, snuggly holiday moments at home. Visit CozyEarth.com and use my exclusive 40% off code MIMS25, that's MIMS25, to get 40% off your entire order this holiday season. And if you get a post-purchase survey, make sure you heard about Cozy Earth from Make It Make Sense. We get a cut of that money, so you're helping us, and you get to stay warm this holiday season. Wrap the ones you love in luxury with Cozy Earth. All right, let's get back to the show. When the government shutdown ended a month ago, I know that feels like a year ago, but it was really only just last month. It ended because Republicans in the Senate promised Democrats they would have a vote on health care, something to offset or alter or maybe even replace the expiring Affordable Care Act or Obamacare subsidies that are set to expire at the end of the year. Those help people pay for the cost of going to see their doctor. I cannot be more clear than that. It helps them get their medication and oftentimes stay alive. And without it, 6 million people would lose their access to health insurance and their ability to see their doctor without astronomical costs. Without these subsidies, ACA premiums or the price you pay each month will skyrocket by double for some people or as much to 4 times what they're paying now. And since the end of the shutdown, the GOP has been scrambling to figure out what their plan is, which is weird because since President Obama signed the ACA 15 years ago, Republicans haven't come up with a better idea, even though they voted 100 different times to get rid of the law. Now, Trump, despite running on the idea of replacing Obamacare, still doesn't have more than a concept of an idea. Here's what he said to Politico in an interview on Monday.
To you, and should Americans...
What I want on health care is very simple. Obamacare was set up for insurance companies to become rich, okay? That was why they, in my opinion, I think the Democrats did it for that reason. Do you know that insurance company stocks have gone up 16, 17, 1,800% over a short period of time? They've been paid trillions, not billions, trillions of dollars. And what I'm saying is very simple. I don't want to pay them anything. No money for the insurance companies. Sorry, fellas, I know them all. No money for the insurance companies. I want to pay the money directly to the people and let the people get their own health care.
So most of that isn't true. Let's start with the claim that the ACA was set up to make insurance companies rich. It wasn't. It was actually set up to help reduce prices. And studies like a new one out from the Kaiser Family Foundation, or KFF, says that prices for ACA individual plans compared to employer group plans have stayed relatively close when it comes to monthly premiums, with the Obamacare price coming in below the private price more often than not. So why are costs so much more expensive than they were before Obamacare? Because there's no real regulation on the insurance industry. As one researcher at Johns Hopkins put it, this is because of prices, not quantity. It's not that people are using healthcare services more often than they were previously. We're not going to the hospital or the doctor more, and in most cases, we're not using more pharmaceuticals. The prices for those services keep going up, which increases insurance premiums. Effectively, what they're saying there is that it's the insurance industry arbitrarily raising prices on all of us without it being based on any real thing other than their own drive for profits, which the president does mention there. He's right that health insurance company stocks have gone up, but it's not by 1,800%. It's more like 500 to 1,000%. Still a staggering amount of money, don't get me wrong, but why not just say those numbers instead of exaggerating? Now, Trump also says that the Democrats are controlled by the insurance companies, except it was Republicans who got more money in the 2024 election from insurance companies, about $3 million more. Now, those companies play all sides because they're a really powerful lobby, but the number still stands. And then Trump said what he wants to do is help people by giving them money, not the insurance companies, which isn't how these ACA subsidies work. People who are using the Affordable Care Act subsidies can apply for either an annual lump sum or a monthly subsidy when they file their taxes or apply for the ACA coverage online or through a broker. That money goes to that person for them to then pay the insurance company. It also brings us to the most popular plans right now being bandied about by Republicans, which are using what are called health savings accounts. Now, before I get rolling into that, it's important to keep in mind, with health insurance, it is one of the most complicated industries for lawmakers to navigate because it's a complicated web of federal, state, and local agencies combined with dozens of insurance companies, thousands of hospitals and healthcare providers, and hundreds of millions of patients. It is not easy to work this stuff out. I'm also not letting anyone off the hook here either just because it's hard. They chose to run for office. They chose the position they're in now when it comes to these subsidies, so the ball's in their court. What are their plans is the next question, right? Well, the most prominent one is from Louisiana Senator Bill Cassidy. It would create those health savings accounts, or HSAs, for millions of Americans. HSAs have been around for a few decades now and are pretty popular. Basically, it's a savings account that you can only use for certain pre-approved health costs. They also often come with extremely high deductibles or the cost you pay out of pocket. Under Cassidy's plan, an undetermined amount of subsidy money would go to these HSAs directly so that you could spend that money out of your account on a number of pre-approved medical visits or expenses that would be approved by an insurance company that partners with the federal government to cover your care. That plan would also come with astronomical deductibles. We are talking more than $7,000 in some cases, which would ruin hundreds of thousands of American families each year, according to KFF. Now, that plan also has the drawback of giving insurance companies even more power, because while Congress would likely write into any new insurance plan that companies couldn't prohibit you from spending money on, say, your annual checkup or common prescriptions or pre-existing conditions, they would work with insurance companies on those too, letting those companies at least call some of the shots. On the other side of the aisle, in the Senate, Democrats wanted to pass a bill to keep the subsidies in place for at least the next year, if not 2 years, in order for a real solution or compromise to be worked out. But as I'm recording, the Senate just voted against that, so we're back to square one. The leader of the Senate, Republican John Thune, said his members voted no because the bill didn't do enough with fraud in the ACA system, which is a whole other can of worms. To be sure, there are issues with certain kinds of fraud at the federal level for these Obamacare subsidies. The Government Accountability Office just ran a major stress test using fictional names and social security numbers to apply for the subsidies, and all of them were accepted at the federal level. That's a problem, a big one. But for the states with the largest healthcare exchange markets, the ones that have their own versions of the ACA that use federal dollars, they're much better at catching fraud, meaning many of those people who do get caught are just at the state level, not the federal one. And again, we should want them to get caught no matter where the fraud is happening. But preventing fraud is an entirely different conversation that could get dealt with later, as opposed to the one happening now, where they want to prevent millions of people who aren't committing fraud from losing their health coverage or being forced to pay twice or three times as much for their current coverage. As a Georgetown health researcher said, if you have a problem with car thieves in your community, the policy solution is not to make cars more expensive for residents to buy. Which, yeah, but for now, that's what the Senate's doing. Over in the House, things are worse for Republicans. On Wednesday this week, Speaker of the House Mike Johnson presented a menu of options to Republicans on how to replace the Obamacare subsidies. Not one of them included extending the current subsidies, which is what most Republicans seem to want to do right now, because they know without them, it'll hurt them in the midterm elections, as well as actually hurt many of their own voters who tend to use more subsidies more than Democratic ones. Florida Republican John Rutherford told Politico, if we fumble this healthcare bill, nothing else is going to matter. If we don't win the majority in the midterms, then none of this matters. We can't do anything good then. I think everybody understands that. New Jersey Republican Jeff Van Drew, a pretty far-right Republican, called it a bad move for Republicans to let these subsidies lapse. And Wisconsin Republican Glenn Grothman said if the extensions were put up for a vote today, it would pass.
If a vote on subsidies does come to the House before the end of the year, does it pass the House?
I hate to guess. My guess is there are enough people there who will vote yes on anything that if it is the Democrat plan, I think it'll pass the House. I shouldn't say that, but you only need to add 3 or 4 Republicans to all the Democrats and it'll pass.
To be very clear, that is a sitting member of Congress saying that a bill that would allow millions of Americans to keep their health insurance and keep costs down would pass. But Republicans in the House, particularly the Speaker of the House, won't bring it up for a vote. Why? Because it's not what the president wants. Now, that being said, a group of 11 Republicans and 4 Democrats so far have signed onto a discharge petition to go around what Johnson wants to force him to put the plan up to extend the subsidies for a vote. It's the same process as the one used for the Epstein files. 218 House signatures forced Johnson's hand. And with 11 Republicans so far, it is entirely possible to get to 218 with the rest of them being Democrats. The problem is, the vote wouldn't happen before the subsidies expire on the 31st because Congress only has 6 working days left for the year, and there's a 7-day waiting period before it could come up for a vote under congressional rules. Now, Mike Johnson could waive those rules like he did for the Epstein files, but he's not going to here. So, what does that actually mean then? In a political sense, it means that Republicans are going to have to spend 2026, a year in which they are asking for money, trust, and votes from people in their districts and states, answering to those people whose lives just got more expensive as prices on almost everything have also gone up because of the president's tariffs. And they have to answer questions about that because they could have stopped it. In a real-world sense, people are going to struggle. It's not just the 6 million who will lose coverage, but the 1 in 3 people who said they'd drop their current coverage to look for something cheaper, likely being forced to make the trade-off between paying less but also getting worse coverage. Or even worse, 1 in 4 Americans told KFF they'd drop health insurance altogether, which is bad because, 1, you want people to have health insurance so they can go see their doctor. But 2, when they don't have health insurance, people end up in emergency rooms, which by law have to treat them. And then that really does mean taxpayers are paying for that care. On top of it all, our health insurance prices are going up, whether you're on a government plan or a private one, because without the subsidy money, insurance companies are going to keep raising prices to keep their profits and stock prices up. And all of it will happen because the party in power in Congress and in the White House are unwilling to just keep the things the way they are for now until they come up with a better plan. I've said this before on the show, that leadership is the price of winning elections. And right now, Congress is devoid of it. And it means we're all going to be losers. All right. Thank you so much for listening today. That's it for this episode. Please rate and review the show, whatever podcast app you listen to it on. It really helps boost the show on those platforms. Like and subscribe on YouTube. It helps boost it there. Sign up for the Make It Make Sense Substack. You can get brand new deals during the subscription drive right now. And as always, share the show on social media. It's MIMS News Pod. That's MIMS News Pod, all one word on every platform. I am at Grant Herms on Twitter and Blue Sky, and at Grant_Herms on everything else. Thank you so much for listening today. I'm Grant Herms, and I'll talk to you tomorrow.